Hello everyone, this is Dr. Sam and today we will study appendix ultrasound. The appendix is a tube-shaped organ in the right iliac fossa. It arises from the cecum. A normal appendix can be hard to find. The diameter must be less than 6 millimeters. Appendicitis is the inflammation of the appendix. The appendix will be dilated. The diameter will be greater than 6 millimeters and the appendiceal wall thickness will be greater than 3 millimeters. These are transverse images of the normal appendix and the inflamed appendix. You can see the increased size of the appendix here. The diameter is greater than 6 millimeters and wall thickness will exceed 3 millimeters. On color Doppler, there is increased flow noted in the appendiceal wall. Here is a longitudinal view of appendicitis. You can see a dilated appendix with increased flow on color Doppler. Spectral Doppler studies can be performed as well to help in diagnosis. The peak systolic velocity will be greater than 10 centimeters per second in appendicitis and the resistive index will be greater than 0.65. In this image, the PSV is 14.5 centimeters per second and the resistive index is 0.75. Appendicolith is a calcification located inside the appendix. It is hyperechoic and has posterior acoustic shadowing. This image shows us an appendicolith in a transverse view. It is a hyperechoic calcification with posterior shadowing. Hyperechoic periappendiceal fat is another sign of appendicitis. The appendix will be surrounded by echogenic fat. In the normal image, this fat is not prominent, whereas in appendicitis, it can be seen very clearly. Here is a transverse image showing hyperechoic periappendiceal fat. This periappendiceal hyperechoic fat structure will usually be measuring greater than 10 millimeters. It will look like a thick layer of fat surrounding the inflamed appendix. Here is a longitudinal view showing hyperechoic fat structure measuring greater than 10 millimeters. Periappendiceal fluid is another feature of appendicitis. You can see fluid surrounding the appendix. Overall, it has made the appendix hypoechoic as compared to the normal one. Here is a transverse view showing periappendiceal fluid. We can see a bit of fluid in this area. A perforated appendix can be very difficult to visualize on ultrasound. It presents with a full thickness defect in the wall of the appendix. This is the defect. Abscess is also seen outside the appendix in the right iliac fossa. This is a longitudinal view showing a defect in the appendiceal wall and abscess outside the appendix. Thank you so much for watching. Please subscribe and stay tuned for more imaging videos.